You are an FY2 in general practice. You have been asked to see Mr. Jones, who is a 32-year-old gentleman, about his symptoms.
Hi, Mr. Jones.
Hello.
Hi, my name is Dr. Butt. I'm one of the FY2 doctors working here at the moment. Can I just start by confirming your full name and your date of birth, please?
Yeah, it's Adam Jones. I was born on the 20th of June 1987.
Right, thank you very much. So, how can I help today?
I've come in just because I've been vomiting quite a lot.
Oh dear, how long has this been going on now?
We started last night.
Yeah? Can you tell me a bit about last night? How did this start?
Well, to be honest, we went out for a few drinks, and then the vomiting started after that.
Okay, you mentioned a few drinks. Was it quite a lot?
It was quite a lot.
Quite a lot?
Yeah.
Okay. And with the vomit, what sort of things were you bringing up when you're vomiting?
Well, at first it was mostly just normal vomit, really.
So at first it was. Did anything change in that?
Well, later on, there was a bit of blood in it later on.
Oh yeah, okay.
But still some vomit.
Yeah, sure. When you say a little bit of blood, was the whole vomit blood coloured?
No, just mostly kind of vomit, just with little bits of blood in it.
So streaks of blood in there?
Yeah, little bits, yeah.
Right, okay. How many times do you think you've vomited since yesterday?
Oh, I lost count. More than 15.
Really?
Yeah.
Gosh, okay. How are you feeling now?
I feel a bit better. I don't feel as sick as I did before.
Yeah. Okay. Apart from the vomiting, are you getting any other symptoms of any sort?
Got a bit of pain here, but apart from that, nothing else really.
Sure. Okay. Is it sort of like how would you describe the pain that you're getting?
It's a bit like when you got like acid, maybe just because of all the vomiting, maybe.
Yeah, sure. Right. Okay. Apart from the pain, are you getting bloating in your abdomen and your tummy?
No.
Nothing along those lines. And how are your bowels?
Yeah, they're okay.
Bowels are okay. No constipation or diarrhea since yesterday.
No.
Okay. And passing urine okay?
Yeah. So
good. As much as you normally would do?
Maybe it's a bit less, but maybe it's because I've been throwing up.
Yeah, sure. Is it burning or stinging or anything along those lines?
No, nothing like that. No.
Okay. Are you feeling feverish at all?
No, not really.
Hot, sweaty, shivery, anything?
No.
Nothing like that. That's
No.
fine. Okay. And have you ever had anything of this nature before?
Not with the blood in it, no.
No. Okay. So sort of like just a general overview-wise, any sort of family history of any similar health problems or any cancers of the gut or anything like that?
Not that I can think of, no.
No. Okay. All right. And so moving on to general health, then do you have any long-standing health problems?
No, nothing. Usually okay.
Sure. And do you take any medication on a regular basis?
No.
No. Are you allergic to any medication?
Not that I know of, no.
Okay. So coming back to the alcohol in a bit more detail, you said you lost count. How much would you estimate you had to drink yesterday? More than 8 pints. Right.
And then some other drinks. I'm sure there was something else as well.
Really? So a bit of mixing of different alcohol.
Yeah, I think so, yeah.
Right, okay. How often do you drink this heavily?
Maybe a couple of times a week. But I only do it when I go out with other people. I don't just sit by myself and drink, so
sure.
I think it's okay.
Alright, okay. And in terms of tobacco, do you smoke at all?
No, I don't smoke.
No. Okay. Right, and so you mentioned, so just to summarise what you've told me so far, so you've been getting some vomiting since yesterday, some pain in your tummy as well.
Yeah.
Bowels are okay, no other real symptoms, and otherwise you're fit and well young man. Right, so the next step is I'd like to do an examination of your tummy, and then we'll have a chat about what may be going on. Is that right?
Yeah, sure.
Great. So there's an example of a history of abdominal pain and vomiting. Have a think about what you thought went well, what went poorly, what would you do differently, and what do you think the diagnosis is? So let's do a quick debrief of the video we've just seen. So that was a history station on someone with vomiting, which started yesterday. With history-taking scenarios, the advice we usually give is stick to a structure. Following a structure will mean you're less likely to forget things and cover all your bases. The other thing that's really important that's come out of this scenario is to pick up on verbal cues. Patients will in the exam say things and they will drop verbal cues which you are expected to follow up on because they may open up an entirely new avenue of the consultation. Sometimes the things they tell you are not aren't something you can fit into this particular consultation, so you can touch on those things like we did with the alcohol without doing a full alcohol history, and then you can follow it up by either offering a bit of advice at the end or suggesting a follow-up appointment to discuss this particular thing in a bit more detail. The other thing that came out of the consultation was ICE, which is something we advise everyone to follow. This is a concept where we're trying to investigate and find out the patient's own ideas, concerns and expectations, which is what ICE is about. So you can come up with some phrases on how you would address or clarify a patient what they think may be going on, what they're worried about, and what they're hoping you could do. But these are things we'll discuss in a bit more detail during the course.